Lilian Davis was elated when she found out she was pregnant with her son, Amir. As a registered nurse, she did all she could to ensure a healthy pregnancy. But complications during childbirth posed risks for both mother and child. She came to StoryCorps with her sister Gigi Davis to talk about how her fears around Black maternal health became a reality, despite taking every precaution.
As I entered the last part of my pregnancy, my blood pressure started creeping up. My doctor, my OBGYN, said, we probably will want you to get induced. Everything was going really, really well. But the doctor that administered the epidural didn't get it right. He had to have his supervisor come and do the epidural. But then they decided to do a C-section. And the same doctor came to administer the anesthesia, and he just had this aura about himself. He showed no emotion. It was like he just didn't want to be there. And then shortly after that, things started to go downhill. After they did the C-section, I heard them say baby out, but I didn't hear a baby cry. They had to take him to the ICU because Amir wasn't breathing. I got immediately confused and anxious. And the same anesthesiologist, he told me to go to sleep. And I'm like, no, like, how can I go to sleep? And I didn't hear my baby cry, right?
Do you think race played a part in any way in your experience?
I think that if I wasn't a Black woman, he may have showed more compassion and, quite honestly, more courtesy.
His behavior speaks to national studies that actually point to white doctors not having a cultural understanding with their Black patients, or even the myths that circulate about Black women being able to endure more pain. But Black women are 3 times more likely to die from pregnancy related complications than white women in the United States.
I am a registered nurse by background, so I kind of saw firsthand the effects of health inequity around Black maternal health. I was educated. I had insurance. I had a doctor that was a person of color. I felt like I did all the right things. However, I still had an adverse childbirth experience.
As a healthcare professional, what are some solutions to this critical problem?
We need to make sure that women of color have access to maternal care, resources to make sure that they're healthy foods, transportation, maybe having Black doulas and doctors. The other part is holding our healthcare system accountable for these things. And so it just really made me even more dedicated to telling my story. I just wanted to let other Black women know that it is real. No matter if you try to do all the right things, this still can happen to you.
Produced by StoryCorps Studios, in partnership with the Centers for Medicare and Medicaid Services Office of Minority Health. Interviews recorded by StoryCorps, a national nonprofit whose mission is to illuminate the humanity and possibility in us all, one story at a time.